Hello again, Dr. Mashburn, and we'll continue our bone lab videos focusing on the appendicular bones, in particular the pectoral girdle and the arm bones. So just as a review, let me go back. Sorry, I skipped forward. I'm going to get my pen ready. A few technical issues today, I apologize. So if you remember from our previous lab video, we talk about the skeleton in terms of being appendicular or axial. So we've already talked about our axial skeleton, so this is in blue, which included the bones of the head, so your skull, including your cranial bones and your facial bones. Also the bones of the vertebral column, so we talked about all the different types of vertebra, and we talked about the ribs of the thoracic cage. So now we want to focus on the brown bones, okay? So the ones that are highlighted in brown is our focus for the rest of these labs. Today we're going to talk about the bones of the pectoral girdle and the upper limb, which includes the upper arm and the forearm and the hands. Okay, so we're going to talk about each one of these bones and also point out the features that you're required to know. So let's start with the pectoral girdle. The reason we use the word girdle is a girdle would hold something on. So your pectoral girdle holds your arms on to your axial skeleton. And so the bones that help hold your arm on are your clavicle. This is the clavicle. And then this bone back here, I'm going to basically outline it. That's your scapula. So these are words that may be unfamiliar to you. Clavicle, you probably grew up calling a collarbone, and a scapula, you probably grew up calling a shoulder blade. But we're going to use scapula and clavicle for this course. So the clavicle would have been your collarbone, and the scapula would have been your shoulder blade if you've learned those words before. So the clavicle is what and the scapula form a joint here. You have a acromioclavicular joint where the clavicle and the acromion process of the scapula join. And then the clavicle joins your axial skeleton at the manubrium of your sternum. So you'll see your clavicle is holding your scapula and your humerus, this is your arm bone, to your body using that joint right there between the clavicle and the manubrium. So this is the attachment side to hold your upper arm or your arm onto your body. These also provide attachment sites for muscles. So you heard of something called a rotator cuff that allows you to have full range of motion in your shoulder. So those muscles are going to attach throughout certain attachment points throughout the scapula and the clavicle. So we're going to talk about these bones and some things you need to look for as far as their features. So again, this is the clavicle, and this is a right clavicle, and so it's easier to do the right and left when you watch the videos with Miss Graham. So using your textbook and also her videos, you'll be able to distinguish right and left. I'm just going to use this video today as a means to talk about particular features. So the clavicle is kind of an S-shaped bone, all right, and it has a flat end, and this is the sternal end, so this would tell you this would be the medial end, and then it has an acromial end, which is kind of hooked. And this hooked end is the lateral end. So if you're thinking about orientation in the body, then this would be toward the sternum, and this would be toward your arm, your humerus bone. Okay, so that's what you need to look for. There's not a whole lot of features on the clavicle, so really all you have to do is just focus on the actual bone itself and determining if it's right or left. Again, you can tell that using your textbook and also looking at Ms. Graham's videos. All right, so the scapula, what we're looking at the posterior, so we're looking at the back aspect of it. And so this will be your scapula, and you have a spine, so this part that sticks off the back. And so if you're looking at a scapula, it has a smooth side. The front of it's smooth, and the back has this bony process called the spine. And the bony process or spine will end in a process called the acromion process. Okay? You also have something called the coracoid process. And so these two processes together, they form the part of the shoulder joint. And so your humerus would fit between those two processes, your coracoid process and your acromion process. As you're looking at the back of the scapula, you also have to determine what's the medial and lateral side. Well, if your humerus is going to hang down from your scapula right here, that would make this the lateral side, so obviously the other side would be the medial side. So you need to be able to determine your lateral and medial side of your scapula. So on this one, we're going to just do some real bones, and let me show you what we're looking for. So see this smooth side? That's the anterior side. So if you see this rough side where you've got this spinous process, where you have the spine of the scapula, that tells you you're on the dorsal or posterior side. Here, this is called the glenoid. And so I'm going to go back to this previous slide. Your glenoid cavity is going to be right superior or inferior to the acromion and coracoid processes. That's where your humerus actually articulates with the scapula. So you have your glenoid process here. Here is your acromion coming off the top of the spine and your coracoid process. Okay, here would be your acromion process because you're on the spine. And this is a good view of the coracoid process. Again, this would be your medial side because it's going to be the side that attaches, your lateral side, sorry, your lateral side, which attaches your humerus to the, to the scapula. So this would be your lateral side. And then this kind of curved side is going to be your medial side. So those are the things you need to look for, the features on your scapula. And again, you'll see these again in the videos, the YouTube videos with Miss Graham. All right, so the humerus is a single bone that makes up your upper arm. So it's the upper part of your arm, which is what we call the arm. So if you look at an arm, we say this is the arm, and then the two bones that are below that are the forearm, if you go back to your region names. So the humerus is the bone that makes up the arm, which we consider our upper arm. And then you've got your radius and ulna make up your forearm. And then you've got your fingers and your hand, okay? So this is the humerus, and we're looking at both the front side and the back side. And if you look in your textbook, there's a bunch of features. I've tried to remove the features that you don't need to know, and I've just left the features that you do need to know. There's a couple of extra ones that are on your pictures just for information, but again, I'll point out the ones that are required in your lab book. So as a review, this long part of this bone, this is a long bone. This would be the shaft. Do you remember the shaft? Well, I can't even spell today. Shaft. What else do we call it? The diaphysis. Remember that? So we have the diaphysis, and then the ends we have the epiphysis. All right, so when we're thinking about a humerus, we've got to determine the proximal and distal ends. So if you find the head, which is this rounded area, this is going to be the proximal epiphysis, and then this wide area is going to be the distal epiphysis. So I've got a picture here to show you how it orients in the body. So you need to be able to determine your proximal and distal sides. That will help you when you determine if you have a right or left humerus. Again, you'll watch Miss Graham's videos to make that more clear. The features you need to know will be the head of the humerus. You also need to know two fossa, the olecranon and the coronoid fossa. The olecranon fossa is going to be the bigger depression on the back of the bone. The coronoid fossa is the smaller depression on the front of the bone. You have two articular surfaces. You've got two places where the elbow joint is made using the radius and the ulna. And so you have this round one called the capitulum, or little bald head, and then you have this kind of, to me it looks like a spool of thread laying on its side. So this is called the trochlea. Okay, so that's two of your articular surfaces that form the joint. And then because those are smooth places that act like rockers, we would call those condyles. So your capitulum and your trochlea, you could consider those as condyles. And so then these little bumpy places above them, so epi means above, would be your epicondyles. So your lateral and medial condyle. All right. So again, moving down into your forearm, you have two bones. You have the radius and the ulna. Okay, so this would be your radius over here, and this would be the ulna. Okay, so this is your ulna here and here, and this would be your radius over here. Looking at the front side and the back side again. And I've got I've added some skeletal actual bone pictures for you to be able to see them in a little more detail. Again, you've got labeled pictures in your online lab guide at the Start Here page, and you've got your book, and you've got Miss Graham's videos. So the radius, the way to remember the radius is how you measure a circle, and so the bone that has a circle on it, that would be your radius, which is just an easy way to remember it. And that circle is the head. Okay, so that circular part is the head of the radius. It's the proximal end of the radius. The distal end has what's called a styloid process, so it's got a kind of a pointy end. And then you've got a radial tuberosity. There's just a little bump on the radius. Now the ulna is a little more detailed. So here's your ulna, this bone here. And the ulna has what's called the olecranon. So the olecranon is up here, and then the coronoid process. So you have your olecranon process and your coronoid process. And these are joined together by a U-shaped depression called the trochlear notch. And some people also call it the semi-lunar notch because it looks like a half moon. So the olecranon process and the coronoid process come together and form this U-shaped structure called the trochlear notch. Well, this is where the trochlea fits. So the trochlea of the humerus will basically fit into that trochlear notch, okay? And the olecranon process, as you bend and straighten your elbow, that olecranon process will go into the olecranon fossa, okay? And the coronoid process, as you bend and straighten your elbow, it will go into the coronoid process. So again, as you see Miss Graham's videos, this will make a little more sense as well because she'll actually show you these bones and how they fit together to form the elbow. So this is just a blown up version of the elbow. Okay, so we have the anterior, the front side of the humerus here, or the elbow actually. So here's the humerus with your trochlea and your capitulum. And you can see that the head of the radius is going to be what articulates with the capitulum, and the trochlear notch of the ulna will articulate with the trochlea of the humerus. And you can see on the back side, you can see how that olecranon process will fit into the olecranon fossa. And on the front side, if you were to bend your elbow, this coronoid process would fit into that coronoid fossa. Okay, so again, just make sure you're paying attention to the names of the bones and these particular features. All right, so we're going to talk about the hand. And so we have a front view, the anterior view, and the posterior view of the hand. So if you're, and what we're going to talk about are how we name the bones of the fingers. Even though these are small bones, these are still long bones because they're longer than they are short. And one place that people get confused is trying to determine the difference between the phalanges and the metacarpals. Okay, so when you think about your hand, here's your radius here, and here's your ulna. So once you're kind of distal to the radius and the ulna, you're in your hand, okay? And so the carpal bones, this is kind of what we think of as our kind of our wrist bones. And so there are 8 of these carpal bones, and so you don't have to learn or be able to recognize the carpal bones for this course. We don't make you identify them. If you're going to go into occupational therapy or physical therapy, you know, that maybe becomes something you need to be able to do, but for this course, you just need to know these as a group name. So the exam would say, name this group of bones, and you would say carpal bones. Now, the next set of bones that are distal to that, 1, 2, 3, 4, 5, these 5 bones, these are your metacarpals, and this is what makes up the palm of your hand. So if you're feeling the palm of your hand, then you're going to be feeling these bones, okay? So these are not finger bones. And so whenever we name the bones of the hand, we start with the thumb, and that's number 1, and then number 2 is your pointer finger, number 3 is your middle finger, number 4 is your ring finger, and number 5 is your pinky. Okay? But we can't use those thumb, forefinger, middle finger, ring finger, and pinky. We have to give these individual bones a name. So this bone, which would be the metacarpal that's is the palm part of your thumb, this would be the metacarpal number 1, okay? And then this will be metacarpal number 2, metacarpal number 3, metacarpal number 4, and metacarpal number 5. All right? Now the bones that are even more distal to that, so I'm going to draw a line. I'm going to do it over here, kind of get a clean slate. These are the bones of, sorry, let me pull that down. There we go. Let me erase that just a little bit. Whoops. Okay. So these bones, these are going to be what we call our finger bones. Okay, and they're actually called the phalanges. And so one phalange is called a phalanx. And I'll write that for you. lengths. And so again, we want to name these bones. You have to be able to name each individual bone or finger bone. And so again, we start with the thumb. So 1, 2, 3, 4, 5. And then we say they're either proximal, middle, or distal. So the one closest to your metacarpal would be the proximal one. So this would be proximal, 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 proximal. The next one would be middle. And then the very distal one would be distal. And the thumb only has two. The other 4 fingers have proximal, middle, and distal, whereas the thumb only has proximal and distal. So if you were going to name this bone right here, that would be the number 3 distal phalanx. Okay? All right. So let's go to a picture of a hand and see if we can figure out what some of these are. So if I was pointing to, let me get a color that maybe we all can see. Maybe not. There we go. If we're going to point to this bone right here, so that would be the 1, 2, 3, 4, 5. So number 5, metacarpal or metacarpal number 5. I'll accept it written either way. Okay, so number 5, metacarpal or metacarpal number 5 of the hand. This bone here, this one here, would be the number 5 middle, number 5 middle phalanx. This bone here would be the number 1 middle phalanx. So do you see how we're doing that? So basically you decide if it's 1, 2, 3, or 5. Thumb's number 1, pinky's number 5. Is it the proximal one closest to the torso? Is it the middle one or the most distal one? So take some practice doing that. Again, you'll see Miss Graham's video and get a good understanding of these bones. All right, so the next video is going to be about your pelvic girdle and your legs. So again, watch this video, watch the YouTube videos with Miss Graham where she actually shows you the bones up close, and then we'll do the legs next. Thank you.